Well, Louisiana is seeing a very high number of flu cases this season. The common cold and the flu are both respiratory illnesses, and they have similar symptoms. So how can you tell them apart? Dr. Brent Wallis from People's Health is here with some tips. Thanks so much for joining us.
Sure.
All right, so what's the difference? You have a runny nose, watery eyes, you're sneezing, and you feel bad. What's the difference between the cold and the flu?
Right. Well, both are caused by viruses, and typically you'll have sore throat, sometimes some headache, and a runny nose with them. The biggest difference is with flu, you tend to have high fever, and you kind of feel like you've been hit by a truck, severe fatigue and muscle aches.
All right, so if you can walk around without a problem, you just have a runny nose, you probably have a cold.
Probably.
If you have high fever and muscle aches, you probably need to get to see a doctor.
Especially if it's been over 24 hours, you definitely should go see your physician.
Right. Okay, so it's easy to tell if you have a cold or flu because all you have to do is not a blood test, but you said a nasal swab to let you know?
It's actually it's a swab that the doctor puts in your nose, and it's a rapid test, so we actually know whether it's flu A or B within about 5 minutes.
And then once you find out it's the flu, does the whole course of action change, or is it kind of riding it out?
Well, one of the biggest differences with the flu and cold is that we actually have some treatment options for flu. You know, prevention obviously would be the flu shot, but there's actually medications, antiviral medications you can take if you have the flu, but you have to start them within 24 to 48 hours of the symptoms.
So the symptoms with the flu are as rapid as the test, right? When you get it, you feel it. Is that right?
Comes on extremely fast, yeah. So you know if you'll have it. If you've never had the flu and you get it, you'll definitely know it's different than a cold.
You said you had lots of patients now just coming in one after the other, and it's hard if you're in a work environment to prevent getting it, isn't it? I mean, because some people may not know they have it, they sneeze, and it's in the air within seconds.
Definitely. Just like with any type of illness, if you think you're sick, and especially if you've been diagnosed by a physician, don't go to work. Don't send your kids to school because all you do is spread it around then.
So if you feel like you're going to die, literally, you probably have the flu, get to the doctor as quickly as possible because it can cause pneumonia, or you said even sepsis?
Correct, yeah. You can definitely have secondary illnesses caused by flu. Flu lowers your resistance to bacterial infection, and so pneumonia is a major complication, and really why we're seeing a lot of people in the hospital these days.
It can be serious. Thanks so much, Dr. Brent Wallis.
Thank you.